So today's the endocrine system and some abbreviations related to pharmacology and the commonly used ones in medical field. So the presenters were showing about the endocrine system earlier, and we'll go over the terminologies and the abbreviations. And if you have some time left, we can go over the case report 8. So right on to get started. Suffix dipsia is a suffix that means thirst. So one example is polydipsia. So poly, prefix that means many, plus dipsia, so many dipsia, many thirst, excessive thirst it means. And to the right, I attached a diagram that shows what's called the 3 P's of diabetes. So if a person has a diabetes, they have polyuria, excessive urination, polydipsia, which was excessive thirst, and polyphagia. If you remember, phag-o combining form is a swallowing or eating something. So in this case, excessive phagia, polyphagia, means increase in appetite. So these are the possible symptoms of diabetes. That's handy to remember with those 3 P's. Pancreat-o is a combining form that means pancreas. So one example is pancreatitis, pancreat-o plus suffix itis. So inflammation of the pancreas is pancreatitis. Pancreatitis, sorry about that. And to the right, I show a diagram of how pancreatic endocrine cells look like. So it's not that every cells of the pancreas can produce those hormones. There are specific subsets of cells within this group of cells called islets of Langerhans. So within that, there are alpha and beta cells. So alpha cells in there produce glucagon, which is the opposite of insulin. It increases the blood glucose level by making the cells break down more glucose and release to the environment, release to the blood vessels. Beta cells produce the well-known insulin. It decreases blood glucose by promoting the cells to reabsorb all the glucose back to its cells from the blood vessels and then digest them to produce energy. Adreno is a combining form that means adrenal glands. So adrenal glands are kind of sitting on top of your kidneys. They are responsible for, as the name suggests, creating adrenaline, norepinephrine, and also some water and salt balancing hormones. One example is adrenalitis, adreno plus suffix itis. So adrenalitis is inflammation of one or both adrenal glands. Parathyroid-O is a combining form that means parathyroid glands. So parathyroid glands are situated at the corners of the thyroid gland. So if you look at the diagram to the right, there's a thyroid gland. People commonly refer to it as shaped like butterfly. And then at the edges of those wings are the parathyroid glands. So one example is parathyroidectomy. Parathyroid O plus suffix ectomy, which meant surgical removal. So parathyroidectomy is a surgical removal of one or more parathyroid glands. Thymo is a combining form that means thymus. So thymus is located in between your lungs, and as the presenters were showing, thymus is where your T cells are matured to become readily reactable T cells. One example is thymectomy. So thyme O plus suffix ectomy, surgical removal again. So thymectomy is a surgical removal of the thymus gland. So you might notice a lot of the terms so far are terms that refer to surgical removal, ectomy. So one possible reason that is because is if one organ, one of those glands produce excessive hormones, either due to tumor formation or they were stimulated just so very easily. In that case, we might want to artificially control the hormone levels in your body by just removing or partially removing that endocrine glands and regularly injecting or delivering extra hormones to the person's body so we can decide what level of hormone we want to give to the person. Gonad O is a combining form that means sex glands, which includes ovaries and testes, as to the right of the diagram. Ovaries produce estrogen, which is an important woman's sex hormone. Testes produce or secrete testosterone, which is an important male development hormone. One example of gonad O is hypogonadism. Hypo, prefix that means deficient or below, plus gonad O, plus ism was a suffix that means condition. So hypogonadism is deficient secretion of hormones by the sex glands. Pituitary O is a combining form that means pituitary gland. So pituitary gland is located right below hypothalamus within the brain. So to the diagram to the right, you'll see the zoom in image of hypothalamus at the top, and there is like a sac kind of hanging off under the hypothalamus. That is what the pituitary gland is. There is an anterior pituitary gland, which is colored by blue blood vessels, and a posterior pituitary gland. They both produce different types of hormones, and pituitary glands are mostly responsible for hormones that control other hormones production level. And it usually gets the signal first from hypothalamus, and you might notice there are some yellow lines that's connecting to posterior pituitary gland. Those are actually neurons. So hypothalamus and pituitary gland are unique ones in the sense that they not only use hormones to interact, but also neurochemical signals to determine what and how much hormone to produce. So the signal usually starts from hypothalamus. It creates hormones or neurochemical signals to stimulate pituitary gland, and pituitary gland produces another hormone that stimulates endocrine glands throughout your body, such as adrenal glands. To the left, I wrote down HPA axis, which is the case where hypothalamus sends signal to pituitary to adrenal gland. This is commonly referred to as HPA axis, and that hormone axis, that endocrine axis is called a stress response regulator axis. There is also HPG axis. It starts from hypothalamus to pituitary, but then now to gonadal areas. So HPG axis acts as a reproductive signal regulator, as gonads are responsible for reproductive hormones. So one example of pituitary O combining form is hyperpituitarism. So hyper prefix that means excessive or above, pituitary O plus ism suffix. Hyperpituitarism is excess pituitary secretion that can cause acromegaly or gigantism. So one of the hormones produced by pituitary gland is a growth hormone. If excess pituitary secretion happens, it might also result in gigantism or acromegaly, we'll actually cover a little later. Which is right now. So suffix megaly is suffix that means enlargement of something. So one example is acromegaly, which we were discussing. Acro is combining form that means extremity. It usually refers to extremity of your body, such as fingertips, feet, toenails, and jaw, for example, and suffix megaly. So acromegaly is a disorder marked by abnormal enlargement of the extremities, which are hands, feet, face, and jaw, due to excessive growth hormone produced by anterior pituitary gland. So diagram to the right gives a case in which anterior pituitary gland has a tumor, pituitary adenoma. So there are excessively more cells that can produce growth hormones in this case. And those excess growth hormone can lead to acromegaly, which makes the person look like the person to the right. The jaw extending is kind of like a phenotype, a characteristic phenotype of acromegaly. Thyroid O is a combining form, is for thyroid gland. So thyroid gland was that butterfly-shaped endocrine gland located on your neck. And one example of combining form thyroid O is hypothyroidism. Hypo is a prefix that means deficient. Thyroid O is a combining form, and ism condition. So hypothyroidism is deficiency of thyroid hormone secretion. And such deficiency of thyroid hormone secretion results in various symptoms as shown to the right. It can result in hair loss, can also alter your heartbeat rate, your heat sensitivity, can also lead to changes in menstrual cycle. One characteristic phenotype is weight gain, and also you have an enlarged thyroid gland as a result of it, which is also referred to as goiter. And goiter can also result from hyperthyroidism, but in the case of hypothyroidism, it happens because low thyroid hormone level prompts the thyroid to grow larger to try and compensate for its inability to produce enough hormone. This is not specifically a term, but I thought it might be important to know. So HCG is a short acronym for human chronic chorionic gonadotropin. So HCG is a hormone produced by placenta during pregnancy that maintains the uterine lining and by signaling the body to stop menstruation. So HCG is the pregnancy hormone, and it is commonly used to test pregnancy. And the reason being is It has very low false positive rate, as HCG is only produced in the pregnant female. So there are two ways to test for HCG. One that's commonly done is with a urine dipstick test. So this is more readily available in over-the-counter. Probably you saw a lot of like those devices where it shows 1 line or 2 lines. But it can also be done through the blood test, because HCG, after all, is a hormone that circulates through your cardiovascular system. So now I'll go over some common abbreviations, specifically in the pharmacological field. So IV, you might remember, is an intravenous, into the vein. So it's usually used in context of injection, like intravenous injection, IV injection, or IV supplements. SOB is a short for shortness of breath. TID is acronym for 3 times a day, or is abbreviation for 3 times a day. And it's easier to remember by considering that T at the front as 3 or trio. So TID is 3 times a day. It's usually used in context of prescribing medicine, like please take this medicine 3 times a day. Take this medicine TID. LDL refers to low density lipoprotein. LDLs are what's called the good protein, a good lipid, or cholesterol, and HDL is what's referred to as bad cholesterol. HX is history, DX diagnosis, SX symptoms, TX is a treatment, and QHS or HS is when the medicine should be taken at bedtime. We'll say, take this medicine HS at bedtime. PT is short for patient. EKG or ECG is the electrocardiogram, where you would see people having like electrodes attached to their chest and like to the side of their belly, and maybe to the legs and to the side of the arms too, to measure the neural impulses within your heart, to ensure your heart is beating at the correct rhythm. MRI is magnetic resonance imaging. You guys probably already know what MRI is. CT, computed tomography, also a CT scan. RBC is a red blood cell. WBC is a white blood cell. So RBC and WBC are usually used in context of blood tests, like RBC count versus WBC count. BP is short for blood pressure. HR is short for heart rate. RX, you might have seen this one a lot. RX for prescription. OTC, over-the-counter medicine. PRN, this one is used quite a lot. So PRN means as needed. So you want to say, take this anti-inflammatory drug as needed. Take ibuprofen, PRN, it could be said. AC refers to before meals. Also in the context of medicine, take it before meals, take it AC, or this is a duplicate, but take it at the bedtime. You can say take it HS. BID is short for twice a day, similar to TID, but you can think of it as bipedal, as in bi, plus ID. BID twice a day, so take this medicine BID, take this medicine twice a day, kind of. PO is by mouth or orally, also in the context of medicine. Take Zyrtec by mouth twice a day, for example, be said. Zyrtec PO BID. NPO is when the medicine should not be taken by mouth, but through other routes. So NPO is, you can think of it as no PO, no PEZ. IM, similar to IV, but intramuscular, so into the muscle. So these are injections that's delivered to your muscle, which are commonly your vaccine injections. IM. ROM is range of motion. CBC stands for complete blood count. Doctors can request complete blood count panels where you would harvest some blood from the patient and test for previously RBC counts, WBC count. There's something called bilirubin you want to count for as well, for example, and antibody levels are also important to check for inflammation. FX means fracture. UA, urinalysis. So urinalysis refers to testing your urine for pH, any infections, or any byproducts that should not be in the urine at high levels, such as glucose in the case of diabetes. BPM stands for beats per minute, as in heartbeats per minute. So there are some abbreviations for vital signs too. So people refer to it as TPRBP. So the most important 4 vital signs are temperature, stands for T, pulse or heart rate, stands for P, respiration rate, stands for R, blood pressure, stands for B. So hence TPRBP. And to the right, I also attached the normal range for adults to have a normal range of vital signs for adults, but I'm not asking anyone to memorize this, though it would be great to know at the back of your mind if you ever tested yourself and to see if you are doing great. But most of the days, and these days, like your smartwatches does it automatically for yourself, even tracking your common rate across the days too. So, but these are the common vital signs that are tested. Recently, oxygen saturation, SpO2, is getting tested as well. And last is the case report 8. So this was an interesting case where the female who had an Alzheimer's disease also had that degeneration in the area that is responsible for your vision. So she had a specific syndrome called homonymous hemiatrophy. So some background informations: posterior cortical atrophy. So also in short is PCA, is built by posterior, which means rear or back, plus cortic O. Combining form that means cortex, as in like the cortex of the brain, outer area of the brain, plus suffix al pertaining to, plus a prefix that means without something, and suffix trophy, development, without treatment, without development, atrophy, might remember from muscular atrophy, lack of muscle development, or waning of muscle. So posterior cortical atrophy refers to a disease involving progressive degeneration and wasting of the posterior cortex, which is the back of your brain's cortex, where your visual cortex is also located, or occipital cortex is located, that is responsible for allowing you to analyze the signals from your eyes. So apparently Alzheimer's disease can also rarely lead to degeneration of occipital cortex, resulting in PCA. And the disease discussed in this paper was called homonymous hemianopsia. So homo is prefix that means same. Hemi, prefix that means half of something. And n, without, n means without. Opsia is suffix that means some kind of vision condition. So homonymous hemianopsia is a vision loss on the same side of your both eyes. So something that a lot of people find it very interesting is your brain is not wired so that you take all the signals from right eye and have it analyzed on one side of your brain, all the signals from your left eye on one side of the brain. No, it doesn't work like that. It actually takes one side of your vision. In this case, you will see that circles above the eyes on the diagram. It has red on the right side, blue on the left side. That single colored, that blue side, left side signals will follow along the neurons to reach some place called optic chiasm, where the cross of those neurons happen, so that all the blue signals go to the right side of your brain. So the left vision field goes to the right side of your brain, and all the right side of your vision, which are the colored red, converge and goes to the left side of your occipital cortex. So if you have a problem in your left occipital cortex, in this diagram, there was a stroke in the left occipital cortex, cutting some blood supply to the brain cells in there. It can result in right side of your vision field getting lost. And this was indeed the case for this patient in this paper, where left occipital cortex damage led to defect in the right side vision in both eyes. So one excerpt from the case report we can go over is the patient is a pleasant 77-year-old female who represented to the neurology clinic to evaluate unexplained events of syncope. So neurology should be pretty obvious. Neuro plus ology, study of nervous system and its disorders. But syncope is a medical term for brief loss of consciousness due to reduced cerebral blood flow. So this is a fancy way of saying fainting. Incidentally, she reported cognitive difficulty over the 1 to 2 year period prior to first clinical visit. Family history was positive for a sister with progressive dementia. Second excerpt I prepared goes, she had been followed closely by ophthalmology. So ophthalmology was a term that combines ophthalmolo plus ologist, specialist. So eye and vision care specialist or ophthalmologist. So she had been followed closely by ophthalmology and was found to have right-sided homonymous hemianopsia exam, which is confirmed by visual field test, and had brain MRI, which did not show clear lesion other than small multiple non-specific white matter lesions, but also showed an asymmetrically larger posterior horn of the left ventricle with more prominent atrophy of left occipital lobe. So that was a very dense sentence, but to break it down, lesion usually refers to a pathologic change of the tissues due to disease or injury. And they're referring to asymmetrically larger posterior horn of the left lateral ventricle with more prominent atrophy. So I attached the diagram to the right. So lateral ventricles are the two horn-shaped organs, like a C-shaped organs, in the anterior view. And of those, we're referring to the left lateral ventricle, so which is the one that actually is to the right, because we're looking at the brain from the mirrored side. So of that lateral ventricle, the posterior horn of it is the one that I circled with red. The posterior horn of the lateral ventricles is where it was affected and had an atrophy, wasting or lack of developmental tissue. So I will skip the group discussion for the sake of time, but some announcements are case report 9 is due November 24th. That is Monday of the week of the Thanksgiving. Case report 10 is due December 8th, which is the Tuesday or Monday of that week. And I will also assign comprehensive exams, which is going to be due at December 19th. I think that's the last day of classes. Last day of the semester. And I will open it at December 8th, 9 a.m. So this final exam only consists of 10% of your grade. So you should not even worry about taking it unless you are desperate for points. But I still encourage you to take it just for the sake of challenge and see how well you remember all the terms. But I'll make it available. It will be in the form of kind of like match the term to the definition or define like a short answer where you define the definition of a combining form, for example. And roleplay projects, which is gonna be either this coming Tuesday or December 2nd, the Tuesday after Thanksgiving. You just have to bring yourself. I will provide all the required printouts. But please read through the diagnosis charts and the grading rubric I added to the Google Drive. Everything um, that is to be that is for you to know is actually only in the diagnosis chart. I think you might remember I was mentioning you have to know everything in the lecture slides that are highlighted blue or orange, but I kind of changed last minute that since it's a DeCal after all, I don't want to pressure anyone too much. So everything that you need to know are within that 11-page PDF of diagnosis chart. Symptom chart for the patient side will be very similar to the diagnosis chart. Most likely will only contain your vital signs, symptoms, and medical histories, also in the medical term, so you can relay that information with a common term to the doctors, and doctors will try to guess what that disease is. So if you have not done so yet, please sign up to be a doctor or patient role on either one of these days by November 18th, which is tonight. And if you don't sign up for one, or your name is listed in this sheet but you don't have a partner by then, I randomly reassign you for the same day. And this was the last lecture of this year. I guess last official lecture. I guess I'll still see you for the project, but thank you so much for this year.